Hi, welcome. We're going to give everyone a minute or two to join us. Thanks for coming today. We're going to be talking about our new SNAP participation metric, and we're glad you're here with us. Hi, everyone. Good afternoon. My name is Hannah Wade. I work for the Congressional District Health Dashboard. I'm joined today by my colleagues Avalon and Eileen, and we're going to be talking today about our SNAP participation metric. We typically have these virtual office hours once a month where we walk through the dashboard and give a little background on why the dashboard started. And this time, because of our new SNAP participation metric, we decided to do a virtual office hours that would just be focused on SNAP participation. That being said, if as we're going through the dashboard demo today, if you have any questions about the background on why we started the dashboard or on things you're encountering on the site that you have questions about, feel free to put those questions in the chat or the Q&A, and we will get to all questions by the end of our time here today. Before we get started, we just have a quick poll for folks. If you're able to see a poll that comes up on your screen as to what your congressional district is. It's really useful for us to find out where folks are coming from, and then I often use the poll results to pick a district when we're going through the demo. The way today is going to work is that I'm going to start us off by talking through some of the basic background information on the dashboard, but we've cut that part a little short, so we have sufficient time for Eileen from our data team to talk about the SNAP participation metric, and then for us to also get into a demo. So we're going to go ahead and get started. I think the poll is still active, but Avalon, you can end it when it makes sense. If we can go to the next slide. So until the launch of our Congressional District Health Dashboard, there was not rigorous nonpartisan data on health and conditions that affect health that were widely available at the congressional district level. You could often encounter data at the state and county levels that were similar to this, but really very rarely at the congressional district level, and certainly not from a nonpartisan source and not for free. So that is what we do at the dashboard. We provide these data at the congressional district level for free, and we're funded by Robert Wood Johnson Foundation to do that. You can go to the next slide. As I was saying, we provide granular data at the district level. Our data is straightforward and unbiased, and our aim is to help inform and catalyze priority setting. We believe that data can reveal trends, reveal challenges, as well as opportunities. It can also be used to inform folks about what's actually going on the ground. And finally, we can use it to hold elected officials accountable. We know that data alone is not enough to make change, but we believe it's an essential component of it. We can go to the next slide. So this is what the Congressional District Health Dashboard measures. We are talking today about SNAP participation, which is one of our social and economic factors. There are 5 domains: health outcomes, social and economic factors, as I mentioned, health behavior, physical environment, and clinical care. We'll spend a little bit more time on the demo talking about some of these, so I will move us along to our next slide for now. So our metrics, we try to balance them across those 5 domains. So we also have other reasons why we may add a metric to the site and the types of things that we're looking for in the data when we're choosing to add a metric. We do primarily use and look for national data sets. So these are, that's so that we can cover the whole country with the data that we choose. We also look for rigorous methods underlying the original data collection. We look for measures that reflect public health priorities and that are going to be updated regularly so that we can provide those updates on our site. And as I mentioned, they're balanced across the 5 domains. So The new SNAP metric really met all of these criteria. And moving to the next slide. So we've added the new SNAP metric to provide congressional staff, food policy advocates, and other stakeholders with timely data to support efforts to strengthen our nation's nutrition safety net. SNAP, or as you may know it, the Supplemental Nutrition Assistance Program, is one of the primary tools that the federal government has to address food insecurity in the United States. As such, it is a frequent focus of federal policy conversations and changes, especially in the last year, as major changes to the program were introduced in HR 1. So without further ado, I'm going to hand this off to my colleague Eileen Shea from our data team to tell you more about the new metric. Eileen?
Thank you, Hannah. So as Hannah said, my name is Eileen Shea, and I'm a data analyst with the Congressional District Health Dashboard. One of the areas that I focus on a bit within the team is metric development, so getting new metrics onto the site. And SNAP participation was my latest project in that pipeline. And so I'm excited to talk to you all more about it today. Next slide. So the SNAP participation metric that we provide on our website is the percentage of households participating in the Supplemental Nutrition Assistance Program in the past quarter. So we're able to provide this data at both the congressional district level and the state level. Very exciting that we're able to provide it for all congressional districts nationally. We're also presenting this data going back from Q4 of 2022 through the most recent quarter available is Q3 of 2025. And this aligns additionally with our other metric, Medicaid enrollment on our site. And we're aiming to keep this metric timely by continuing to make data updates. And so we already are working on a data update for July, where we'll add the latest Q4 of 2025. So we're using two different data sources to calculate this metric, the American Community Survey and the U.S. Department of Agriculture's Food and Nutrition Administrative Program data related to SNAP. And so why are we using these two different sources? It's coming down to both timeliness and accuracy. So those of you who are familiar with the American Community Survey, it's only available through 2024 now, and those are annual estimates provided by the survey. So our data going through the end of 2025 is getting at a much more timely data cadence. And then additionally, survey respondents tend to unfortunately underreport participation in programs like SNAP. This is potentially due to social stigma or additional reasons due to program name confusion across different states. One study estimated that over a third of SNAP households responding to the American Community Survey did not report their receipt of SNAP benefits. And so there really is substantial underestimation from these national surveys, unfortunately. And so we try to address that by only using the American Community Survey to calculate the proportion of households that participate in SNAP in each congressional district. We calculate that by state, and then we apply that proportion to the monthly state counts provided from the USDA's Food and Nutrition Service. And so that allows us to really consider the whole pool of participants from the administrative program data. And we derive quarterly estimates by taking 3-month averages of the statewide enrollment numbers from the USDA FNS. Next slide. I'll just provide a brief overview of SNAP. So it was established originally as the Food Stamp Program in 1964 under President Lyndon B. Johnson's administration. And the program originally aimed to strengthen the agricultural economy and improve nutrition among low-income households. And up until now, that really has remained the same mission of the SNAP program. So today, the program still is designed primarily to increase the food purchasing power of eligible low-income households and to help them buy a nutritionally adequate low-cost diet. In fiscal year 2024, an average of close to 42 million individuals in 22 million households participated in SNAP each month. And our data on our website for the most recent quarter, 2025 quarter three, shows that on average across all congressional districts, more than 1 in 6 households in the US participate in SNAP. So it's the largest anti-hunger program in the United States. And these data really underscore that SNAP is a large program in our country's safety net, supporting low-income families and individuals. Next slide. A bit more about program expenditure and where those funds come from. So SNAP is administered federally in partnership with state agencies, and the federal government currently completely finances benefits with splitting administrative costs with states. However, recent federal legislation will shift more costs to states beginning in October 2027. So there are very real changes to the SNAP landscape that are useful to pay attention to. It's considered to be a very efficient program with low administrative costs. So this chart is showing that for fiscal year 2024, federal government SNAP expenditures totaled a little over $100 billion. And of those $100 billion, 93.7% were spent on SNAP benefits themselves. So that's close to $94 billion. And so administrative and other costs at the federal level are only accounting for 6% of costs. So a lot of the money that is spent on SNAP itself is going towards helping households purchase food. Next slide. And this is just talking about how SNAP participation is connected to health. SNAP participation strengthens household food security. Individuals who receive SNAP benefits have been shown to have lower rates of food insecurity than those who are eligible but not receiving those benefits. And importantly, food insecurity is associated with higher risks for a range of poor health outcomes. So this includes chronic health conditions such as diabetes and cardiovascular disease, as well as mental health disorders such as depression and anxiety. And there's also literature showing that food insecurity complicates the ability to manage illness and is linked to higher healthcare costs. And so really, SNAP improves food insecurity, enables families to purchase healthier diets, and frees up resources, which then helps to contribute to current and long-term health and better access to preventative healthcare and reduced healthcare costs. So that's a brief overview of our SNAP metric, SNAP program, and its connections to health. And I'll pass it back to Hannah.
Thanks, Eileen. So before we transition to the demo, I just want to pause to see if there are any questions. I don't see any yet in our chat or the Q&A, but I'd like to give you all the chance to enter in a question. I'm going to switch to the demo, but feel free to put some questions in the chat and we'll get to them by the end. Okay. Just confirming that you all can see my screen now. Okay, great. So this is our Congressional District Health Dashboard homepage. Something weird is happening on our homepage right now. There we go. From our homepage, you can type in a district or state here to see a health snapshot or really a bird's eye view of all the metrics on the site. But for today's demo, I'm going to show you how to explore data on the dashboard starting from a national map. So we can start looking at a national map by clicking on metric maps in the top menu bar. What's going to pop up is a metric selector. So this should look really familiar to you since in the slides we were just going over, we had all of our metrics listed by domain. You can see that here as well. We have different mortality mortality data here available under health outcomes, as well as other important health outcomes like diabetes and obesity and low birth weight. We have numerous social and economic factors, including SNAP participation, health behaviors. There's a few here: binge drinking, physical inactivity. We have a few under physical environment as well. So these are things that are typically measured at not at the individual level, but at we're measuring environmental conditions, and then clinical care measures where we have designated primary care shortage area and Medicaid enrollment. So for today, I'm going to click on SNAP participation, and without further ado, here is our national metric map for SNAP participation. What automatically loads when you enter into a metric map is the most recent time period. So what we're seeing here is the third quarter of 2025, and that includes July, August, and September of last year. So averaging across all congressional districts in the US, an estimated 17.4% of households participated in SNAP. We said earlier this is similar to 1 in 6 households. You can see from the scale bar at the top that there's wide variation across congressional districts, despite the average being 17.4%. We have some districts that are as low as 3% of households participating in SNAP, and some districts with as high as almost 60% of districts participating in SNAP. We can also explore the map by clicking around and see what those values are depending on what the color is. So we can see right around the US average in Nevada's 2nd district and higher than the US average in Oklahoma's 2nd district. You can change the time period over here if you're interested in looking at an estimate for a different quarter than the most recent one. I'm also going to zoom in on California today. We have someone in our audience from California's 50th Congressional District. So we're going to start our demo by looking at California. So across California, there's pretty wide variation. The lowest district level SNAP participation in California is 9.8% and as high as 54.1%. So these darker districts here are on the higher end of the scale bar, and you can see that when you click on them. You can also see, districts right nearby with much lower levels of SNAP participation, but still showing a significant portion of the population relying on SNAP. I'm going to type in California's 50th district up here just to highlight that district's estimate. So this is California's 50th district. It looks like it's part of San Diego, and it's showing us at the top how the value for this district compares to the US average. So in California's 50th, an estimated 12.7% of households participate in SNAP. We also offer the option to compare not the US average, but compare to the overall California average. So this really shows that compared to the rest of California, the 50th district has a much lower rate of SNAP participation. And you can sort of use the different comparisons to interpret what it means for your district or your community. So now I'm going to spend a little bit more time in the single district view because I want to jump around the map a little bit since a few of you have said what district you're from. I'm going to go to Washington's 8th district. So Washington's 8th district has an estimated 10.3% of households participating in SNAP. I'm going to use the advanced tools to kind of show you how you can navigate comparisons on the map as well, and have it look more like our other map view if you're interested in that. So right now we have the scale bar as Washington's value. I'm going to click on all districts under advanced tools and just show you that you can switch to displaying all districts again, so you can kind of do some exploration just based on the map. So there's this other district right by Washington's 4th, which has a much higher rate of SNAP participation, just north, also a little bit higher, and then to the east, slightly lower or similar to. So there's real geographic variation across the state that is interesting when you click into. I'm also just going to switch back to the US average just to show you again how you can make those changes to help understand your data. So I also just want to share another way that you can look into data on our site, especially as you think about SNAP participation. You might also be interested in comparing SNAP participation and other metrics. So I'm going to go to change metric over here and switch to children in poverty. Our analysis showed that children in poverty and other measures of economic well-being, like unemployment, are highly correlated with SNAP participation, meaning that districts with high SNAP participation also have high rates of children in poverty and unemployment. So children in poverty is one of 30 metrics on the dashboard that we have census tract data for. So you are able to view children in poverty. You're able to view children in poverty at the census tract level. So I switched back to only viewing this district and under advanced tools. And now I've selected view census tract. So if I zoom in here a little bit on the map, you can see some variation and pockets of higher, because they're a little darker, higher rates of SNAP participation. And similar to what I was showing you, when you click around, you can see what that variation is. So we think it's really valuable to be able to look, at the congressional district level, compare to national data, compare to state data, compare to neighboring districts, and then for some of our data that are highly correlated, you may also be interested in really digging into what's going on at the census tract or neighborhood level. So I'm gonna just show you one other feature here. You can now create a customized area of census tracts on our site. So you can say you want to look at this particular area here and see this is looks like Ellensburg. You can say I want to select these census tracts here, and they can be adjacent tracts or not adjacent tracts. And now I know that for this area in and around Ellensburg, the new average of SNAP participating households is 22.8%. So this is a new feature. I'm just plugging it now as part of the SNAP participation webinar, but it's a really useful tool on our website now that you can access. I am just going to take us through one more website feature, and that is our health snapshots. I'm going to go back up here to health snapshots, and use another district that we have from someone who's joined us today, Massachusetts 4th District. So I mentioned before, this is kind of like getting a bird's eye view of all metrics on the site. You're able to really see, this is provided in alphabetical order right now, but you're able to look and see how it compares to the US average, and see an array of around the US average, better than the US average, and perhaps even worse than the US average for some metrics. So this is just another plug and can be useful, especially if you're thinking about, maybe you're interested in SNAP participation in addition to a few other metrics, and you want to see how all of those line up. I might select diabetes and obesity, as well as SNAP. Perhaps the other ones I named, unemployment and children in poverty. And this just gives you like a more comprehensive picture of what's going on in a particular district. You can print this page and use it in a meeting as well if you want. I'm trying to see if there are any questions in the chat before I head out of the demo. Anything in the chat or the Q&A, Avalon? No, okay. Well, great. So that is the end of our demo. And if there are any questions that come up for you, please feel free to ask them. Do we have one last slide, Avalon, that you can bring up? Thank you so much. So this is our info@ email address is the top one. If you're interested in reaching out to us, if you have a question, if you're navigating the site and you would like to talk with us, do a walkthrough, we're happy to connect with you. So please feel free to email us. You can also subscribe to our newsletter at the second link. I think these are going in the chat for you all. And the last link that'll come through is our LinkedIn page. So please feel free to follow and engage with us on LinkedIn. Otherwise, thank you so much for joining us today, and we'll stick around for another minute or so if folks have questions.